A common concern that I have is starting around 2 weeks old is my baby having signs of reflux? And reflux is a medical condition, and there are diagnostic criteria for it, but a lot of parents are mostly concerned about spitting up or vomiting, and some degree of reflux occurs in infants. About even 50% are just happy spitters, and they're going to spit up with feeds, and that's okay as long as they're gaining weight and they're not uncomfortable. If you think your baby is uncomfortable, in pain, or losing weight, you and your pediatrician should discuss other options for treatment of reflux. But some tips that I have is make sure that you're comfortable when you're feeding your baby. You're in a calm position, you're relaxed, the baby is relaxed, and you can sit there comfortably for about 45 minutes or sometimes a little less until the duration of feed and until the baby has properly burped after the feed. So another important part about you being comfortable and the baby being comfortable is try not to wait until the feed before start preparing for the bottle or preparing for your feed. If the baby is too hungry to eat, it also can cause concerns with the baby eating too quickly and too greedily, and then that causing extra gas and eating too quickly because they're starving and they're not going to digest the food properly. So during the day, typically babies sleep about 2 to 3 hours. We wake them to feed, and at night it's about 3 to 4. So what I would recommend is after the baby has their meal, you make the next meal available for you. If that means taking it out of the refrigerator to leave at room temperature, or if you're breastfeeding, you're already ready. But having what you need set up, even if it means putting your phone on the side table or a glass of water, or you have the remote, have a setup so that the next feeding, you already have what you need to make sure that that's a smooth transition. So when the baby wakes up and after you change them, you're already set up for that feeding. It's really important for your comfort level as well as the baby's. If you're burping your baby and you find that the baby is still having some concerns about gas or reflux, try burping the baby more frequently. If that means after every ounce, then do that. After every half ounce, you might need to even do. So 2 different ways to burp your baby. There's 3 that actually I can think of. One would be putting the baby over your shoulder and while holding the head and burping the baby on your shoulder like this. And that's very common. Make sure you have a burp cloth on as well. Another pose for the baby is actually putting the baby's body on your arm close to your body with the legs extended underneath and burping the baby this way. This is also helpful because it puts pressure on the baby's stomach by being on your arm. Most parents, though, especially first-time parents, don't necessarily feel comfortable with this pose. So you do have to be a little more comfortable holding a baby in this way. Sitting might be easier also by holding the baby in this way. And then the third position is actually propping the baby up with bent over a little bit, and then patting on the back of their patting on their back, and while they're over a little bit while holding their head. That's another way you can burp them. After you burp them and after their feed, it's time for them to either sleep or rest. But what's important is if you put them on their back right now, or if they're old enough to do tummy time or some sort of activity, if they're moving around too quickly, it may not be the best idea to do it then. So try after they feed to let them sit for about 45 minutes at an angle before they start doing anything else. This allows all the food to be digested into their stomach before they have a chance to vomit it up. Sometimes babies who are too active are not digesting their food, and then they're gonna spit up. some things to keep in mind about the actual bottle, if you are bottle feeding, is making sure that there's no bubbles in the bottle. Sometimes, again, if you're making the bottle too quickly and you're making the bottle at the moment of the feeding, the bubbles, when you're shaking the formula, the powder formula and the water together, there's too many bubbles and foam, and that can also cause problems. So by making the bottle a few hours earlier will help let the bubbles settle. It is safe to leave a bottle out at room temperature. I would not necessarily recommend doing this if it is hot outside and leaving it out in the heat, but if you're inside and it's room temperature, you can safely leave the bottle out at room temperature for even as many as 6 hours. And lastly, don't prop the baby while you're feeding. It's important during feeding that you try to remain as distraction-free as possible. This is the time for you and your baby to bond the most. They're looking around, they're looking at you, they're smelling you. If you're distracted in any way, or you let the baby feed by themselves, they're not getting that contact, as well as a baby propped up with a bottle is not as efficient as you holding the baby at an angle. So try not to. We're all busy, and I can see with having multiple children at once how it can be an issue not to prop the bottle, but if you're able to, do it. And to attest to all of these tricks, I do find that most parents, their baby spits up during the day but not at night, and that's another way to really weed out those babies who have a medical condition versus those babies who just need some behavioral modifications during the day to help them. Because if they are calm and they're feeding being held at night, and all of these confounding variables are eliminated, they don't spit up that much, it benefits them to just try to do these things during the day as well to see if they work. And then again, if your baby is having pain or not gaining good weight, you may consider other options for reflux.